The muscles involved with breathing are responsible for moving air in and out, so for inhalation and exhalation. So the diaphragm is going to be the single most important muscle for this process to occur. So the diaphragm is going to be internal and it's going to have this dome shape appearance to it. And this is going to form again the dividing barrier between the thoracic cavity and the abdominal pelvic cavity. The muscle of fibers of the diaphragm are going to converge from its margins to this central tendon. And so the central tendon right here then is going to be pulled in either a superior or an inferior position for having and then making that muscle move. So when we have contraction of the diaphragm, then the central tendon is going to be pulled in an inferior position towards the abdominal pelvic cavity. And so what this does is it helps to increase then the thoracic cavity so that we have air able to come in due to an increase in volume. Then when the diaphragm relaxes, like it does here, then that's going to go in a superior direction toward that thoracic cavity, decreasing that size in that thoracic cavity, and so air will flow out. The external intercostals are superficial to the internal intercostals, and they extend inferiorly and medially from the superior rib of the adjacent inferior rib. And so these are going to expand the thoracic cavity by elevating the ribs during inhalation. And this movement is like lifting a bucket handle. And the bucket handle or the rib, when it's elevated, the distance from the center of the bucket is going to increase. So when we have contraction of the external intercostals, this will increase the dimensions of that thoracic cavity. The internal intercostals are going to lie deep to the external intercostals, and their muscle fibers will also be at right angles compared to that of the external intercostals. The internal intercostals, the action of these are to depress the ribs, but only during forced exhalation, when normal exhalation has no active muscle effort by the internal intercostals.